Dizziness can be a common dysfunction of the human immune system. Dizziness is characterized by several symptoms. The most common sign of dizziness is the sense of the surrounding world going round even as one stands or sits at one place. This type of neurological dizziness is quite different from the dizziness one feels after riding a merry-go-round, for instance. The latter is a forced effect while the former is a disease that needs prompt attention of the physician. Proper medical care and medications can definitely lessen the recurring incidences of dizziness symptoms. Mentionably, dizziness or the dysfunction leading to the loss of semblance or physical balance occurs when the labyrinth, the main limb of balance located in the inner ear, fails to work properly. When such a situation happens, the brain stops functioning or functions irregularly, thereby causing dizziness. Many of us feel dizziness after getting up abruptly or when we suddenly bend down to pick up something from the ground. Dizziness occurs as our heart beats or rhythms get a jolt and there is a fall in our blood pressure level. This is also the cause of lightheadedness during the dizzy bouts. The ailments arising from viral infection of the inner ear are the benign positional vertigo, Meniere's disease, and vestibular neuronitis, viral labyrinthitis. Mentionably, Meniere's disease is a lifelong state. But there are instances where this form of dizziness resolves on its own, just as in viral labyrinthitis. Benign positional vertigo leads to rotational dizziness or vertigo when the patient is made to move in particular positions in specific directions. The generally reported positions are at those times when the head suddenly gets tilted backwards, say, when the driver abruptly jams on the brakes, or while turning on the bed. The aged people are easily susceptible to such syndromes. People suffering from Meniere's disease also suffer recurring vertigo. They feel fullness in their ears which may also ring, or they may not hear anything. Such effects may even last for more than an hour. Such fits force the affected person to lie down, preceded by bouts of vomiting and nausea. While viral labyrinthitis or vestibular neuronitis can affect kids and the aged, this dizziness disorder is generally seen among many youths. The patients suffering from this form of dizziness also fall ill due to flu or cold. Their heads feel heavy and they fail to keep their body's natural balance. Try as they might to control themselves, they ultimately fall to vertigo. There may be a feeling of nausea, and they may also vomit. These signs of dizziness may linger on for days on end. The prominent symptoms of dizziness are a feeling of lightheadedness. There are several other neurological symptoms like reduced consciousness, convulsions, confusion, headache, and appearances of white spots in front of the eyes. There are reports that many people affected by this disorder black out, have fits, vision gets blurred, feel unreal, and/or see stars. More often than not, dizziness is followed by fainting. Here our primary issue will be neurological dizziness. Dizziness is prompted by glutamate. This chemical causes disproportionate neuronal discharges which leads to the aforementioned symptoms. This syndrome can be life-debilitating. If the patient is not provided resuscitation or immediate medical treatment, there may be a scarcity of oxygen. This can adversely affect the functioning of that person's brain. First aid must be tendered within a minute after the patient suffers from neurological dizziness. There are many causes of dizziness. Mention may be made of bulimia nervosa and anorexia nervosa, two of the main eating disorders that are affecting the majority of the X-generation youth. Besides, dizziness can be due to situations that may be emotionally touching. Hyperventilation and low blood pressure are other primary causes of dizziness. Nilutpal Gogoi is a writer and a freelance journalist having more than 18 years of service in several audiovisual and print media reputed organizations in northeast India. He has published one popular adventure book for children and has published more than 1,000 articles for various sites. For more information log on to